Dr. Aga is the co-founder and chief operations officer for Sehat Kahani, which is a telemedicine startup based out of Pakistan. She did her medicine from Ziauddin Medical University and completed her MSc in Global E-Health from the University of Edinburgh. She's a Commonwealth Scholar and also the winner of Heroines of Healthcare Award given by the World Health Summit 2022. Alongside, she is also the recipient of the Singapore Women's Global Competition 2022, winner of the GBH Health Future United Provocateur Award 2022. She is the recipient of the MIT Elevate Prize also in the year 2020 and a Global Challenges Canada Innovator. She was featured by Microsoft for Africa 2020 for the Women-Led Success Stories in South Asia, GSMA Accelerator in the year 2018 and 19, and is also bestowed as a Good Fund Fellow in the year 2017 to 18. Not only this, her accolades are limited, but it also extends beyond getting featured by Forbes for being the founding team of the 100 to watch companies from Asia in the year 2022. Indeed, we do have a digital health pioneer in the room who seems to have really big visions of expanding and calculating digital health in the healthcare ecosystem. So over to you, Dr. Aga. Welcome to the HITLAB Summit and a very good evening.
Hello, welcome. Thank you so much for giving me this opportunity. Really excited to be sharing the work that we've done in a lower middle income country like Pakistan. And I have a little presentation. I can share my screen, right?
Yeah, sure. Feel free to share your screen. You have the access and I'll confirm.
Yes. I think I've. So for everyone who's watching, the name of the organization that I represent here is called Sehat Kahani. Sehat Kahani in Urdu means story of health. And when we created Sehat Kahani, both me and my partner, we had the vision that we envisioned to democratize how healthcare is being given in a developing country like Pakistan. This is me and this is my co-founder. We both are medical doctors by profession with a collective 14 plus years experience of working in the digital health, collectively in the pharma sector, in the community health sector. And I think one challenge that we both faced in our lives, because of which Sehat Kahani was born, was this. Pakistan is a country with around 220 million plus population. It's the 5th largest in terms of the population in the world. Pakistan has around 245,000 licensed doctors. Now you may think that, okay, this is such a good number, such an attractive number. Ironically, 80% of this number is made up of female physicians who, because of a lot of social and cultural norms, do not practice to their full potential. So out of this 245,000 doctors, 80% of this are made up of women, out of which only 40% ever come back to practice. Another 15 to 17% of physicians, both males and females, leave Pakistan for better work opportunities. This leaves Pakistan with 0.5 doctor for 1,000 patients. And this was the challenge that in our lives, both me and Sarah also faced at one point, that being a physician, especially being a female physician, you have to choose between either having a career or having a family. And one shouldn't have to make this choice. And that's how we created Sehat Kahani. Because while at one point there's 0.5 doctor for 1,000 patients, what this results in is that more than 50% of the Pakistani population lacks access to quality health care. Now, when you talk about, as I already stated, a country which has the 5th largest population in terms of numbers, this makes the numbers really devastating. But a very interesting finding came up. Almost the same number of people who don't have healthcare access now have access to a smartphone. They have access to internet. And we saw that this number was rising. And this became the opportunity that we felt we could leverage. We realized that using smartphones, people should be able to access a physician, no matter where they're based, out of Pakistan. And that's how the company came forth. And that's why I'd like to share Sehat Kahani as a success story. Sehat Kahani is a digital healthcare platform that connects patients in need of quality care to online doctors by affordable, convenient, easily accessible, technology-based healthcare solution. And how do we do it? We do it in three ways. We started the organization in early 2017, and we started by creating nurse-assisted telemedicine clinics, the clinic that you can see in the center. The idea was that existing infrastructure, which is present in remote areas, where there's substantial population, a nurse who's a local from within the community, who can enable patients to be connected to a doctor. So like any other regular clinic where you would walk in as a patient, there would be a nurse intermediary who would allow you to talk to a doctor who's online from a laptop, just like the way we are talking right now. Over the years, we added digital tools. So tools such as e-stethoscope, e-dermoscope, e-fetoscope also further enhance the diagnostics. In 2019, we realized that healthcare is not just the problem of people in communities. It's a problem for all of us, people like you and me. And for us, perhaps the challenges might be different. So for example, for me, maybe the challenge might not be cost, but it's the time that is needed to go to a doctor. And we thought every person should have a doctor in their smartphone, in their phone. That's when we created a mobile application. The Sehat Kahani mobile app has two interfaces. It has a consumer interface and a corporate interface. So anyone from you can actually go onto the Play Store, download it, and access doctors. Our most celebrated feature is accessing a doctor in less than 60 seconds. So you can just do an instant consultation with not only general physicians, but around 40 key specialties, also mental well-being experts. We also started reaching out to the corporate sector, which would allow people associated with corporate value chains and access to a doctor through their smartphone. I think the exciting thing was that when we started or when we launched this application, unfortunately, the entire world got affected by the dilemma of COVID. So when we launched the application, while a lot of people initially didn't understand it, didn't access it, but as COVID came and when a lot of physical healthcare facilities got shut down, people started turning towards our application. And the third thing, which complements both the clinics and the application, is a medical helpline for people who can't go to the e-health clinics or who don't have the mobile app. They can access a doctor just through their regular feature phone. That's what we did. So this is how an e-health clinic looks like. This is how an application-based doctor is accessed. And a regular retail app consumer, anyone who is in need of a doctor can access a doctor. The technology is very straightforward to use. It's easily clickable. The clinical model has an intermediary-enabled module. And all the corporates that we work with have a real-time dashboard, which allows them a daily snapshot of how and where, what kind of healthcare service is being used by their employees. So for example, geographical breakdown, disease-wise breakdown, gender-wise breakdown of every company whose employees are using is a snapshot that the corporates get on a daily basis. During COVID, we actively worked by partnering with the federal ministry in Pakistan. We allowed this application to be made freely available to anyone nationwide. Because of this, we were able to do 100,000 consultations over 6 months. Not only that, because the entire world was affected by COVID and a lot of physical healthcare spaces globally were shut down. So what we also saw was that Sehat Kahani application was used in these countries, all of these countries as well during the COVID times. A majority of these patients were Pakistani diasporas, but we also saw other nationalities using the service also. When I'm speaking to you today, we have a network of 48 e-health centers spread all across Pakistan, enabling healthcare access. We have activated a network of 7,500 healthcare professionals. We're working with 550 plus corporations today. And these include the leading banking sector, telco sector, pharma sector. The employees of all of these organizations access Sehat Kahani services. And collectively through these mediums, we have successfully done 1.3 million consultations. You already talked about the work that we've done, and thank you so much for mentioning, folks. I think that came about as a surprise when Sehat Kahani got mentioned as the 100 to watch companies in Asia this year. And where are we headed? In the next 5 years, we want to be able to scale to 150 e-health centers spread all across Pakistan. We want to be able to reach out to 12 to 17 million users collectively. And I think what's most important is that we're also looking at regional expansion. We want to go into countries which have similar healthcare challenges, or where the similar challenge where physicians are not being optimized to their maximum level is prevalent. That's what we plan to do. A couple of countries that we have identified already include these, but this is not it. Our vision is to go beyond. This is about Sehat Kahani. And if any one of you wants to reach out to me, you can reach out to me here. And I'm available here for any questions that anyone may have.